All right, let's get this elephant out of the room first. Before we get into the subject matter of this film, was your goal in this film anti-vaccination? Tell me about that.
No, this is clearly not an anti-vaccine film, and anyone who has seen it will understand that. This is a film about vaccine safety, and specifically vaccine safety fraud committed by the Centers for Disease Control and Prevention, whose job it is to protect children's health in this country. Right,
so the topic, the subject of this, the individual that you interview is a whistleblower for the CDC then. Tell me, Del, how did you get in touch with this whistleblower?
Well, this is actually, he was recorded in phone calls when he reached out to a scientist named Brian Hooker, who had been investigating the CDC for many years. The whistleblower called him and began confessing these amazing statements, saying that on the MMR autism study, this is the measles, mumps, rubella vaccine, that they had manipulated data, thrown data out, kicked kids off of the study, done all sorts of things to cover the fact that what they were seeing was a causal link between the MMR vaccine and autism. That study ended up coming out saying this vaccine is safe. It's a lie. That's what this whistleblower said to Brian Hooker, and Andy Wakefield was in there very early making a documentary about it. I joined forces with him in April, and we worked hard to make this the powerful documentary that people are seeing now in theaters.
So essentially, they just lied. They conducted a study, found one thing, erased all evidence of that, and then told the public, the American people, something completely different?
Yes, what this amounts to is the most serious medical fraud in the history of medicine. They tested a hypothesis, they found an effect, they found a high risk in certain groups of children, and they covered that up. They could have done a bigger study, a better study, and sought to see if they could repeat it. They could have deferred the MMR vaccination until a little bit later to protect children, but they just chose instead to conceal the facts and put millions of American children in harm's way, and that is completely unacceptable.
And Polly, why did they do this? I mean, this was a deliberate choice. As anyone who sees the movie can tell, why would they want to defraud the American people?
I don't know, and I don't think it's just America. I think this is a worldwide problem. I'm one of countless parents across the world who took our children, trusted our paediatricians in for their shots, and we now have damaged children. I don't know what that would take for them to admit that this vaccine is not safe for so many of our children. It would be catastrophic, basically.
All right, Dr. Wakefield, from a medical perspective, is this an issue with herd immunity, that they would rather have some children suffer from autism than endanger the rest of the population? Or is this about money, the pharmaceutical companies, and just making a buck?
I think let's be clear that, this is being driven at its core by the pharmaceutical industry, and it's a profiteering exercise. If it were not, then they would make single vaccines available to the public, which I've advocated, single measles, single mumps, single rubella, which would protect in the same way against these diseases. You wouldn't hear about the resurgence of measles. You wouldn't have any discussion of deaths or damage from measles or other infections, but they took that choice away. That was a unilateral decision by the pharmaceutical industry, and the government went along with it.
Yeah, to be clear, we have 3 viruses being put into one vaccine. We want to separate those back out because there was never any complaints about autism being caused by the single measles, single mumps, single rubella vaccines, only when they were all put together. So we don't think it's a big ask to just ask the medical industry, the government of the United States, and the governments of the world to say, look, just provide these for parents that are concerned. Let them have the single measles, single mumps, single rubella, has the same amount of protection.
But as a parent, it's very hard to gain that trust back because we trusted the paediatricians, the CDC, and now whatever vaccine they put out, it's going to be very hard for us to trust anything going into our children again after what's happened to us.
Sure, that's understandable, but truly it would address the concerns of the public then if they separated those 3 vaccines, because then people wouldn't be or feel the same fear over vaccinating their children. They'd be able to still inoculate against these deadly diseases just in a way that would be able to statistically show that it would have less harm. Is that correct, Dr. Wakefield?
Well, I think that what we're looking at here is there's a complete loss of public confidence in the public health authorities. In other words, they've lied to us about this study. Have they lied to us about every single other study, every other vaccine? We don't know, but that must be the assumption. They have not acted in the best interests of American children or children worldwide. And so with that loss of public confidence, what needs to happen is vaccine safety science needs to be completely removed from the jurisdiction of the CDC, from the jurisdiction of Health and Human Services, and put in a completely independent organization that is firewalled from the pharmaceutical industry that can give us honest answers about vaccine safety.
Right, so to remove the conflict of interest, essentially. Now, your film, let's talk more about your film. Your film was pulled from the Tribeca Film Festival. That, of course, was founded by Robert De Niro. Did they give you a reason why they pulled that?
No, we requested a reason. We said we should be able to defend the film if there's any counts against it. They never said anything except that from the beginning of this festival, the Sloan Foundation has been one of our supporters. That was the only statement we ever got. And then they pulled the film, and that was it. It's unprecedented. We haven't seen anything like this in film festivals. I mean, think about it. There's been movies that basically claim that the President of the United States bombed the World Trade Center. That played in almost every film festival in the world, almost every theater in the world. Yet for some reason, they don't want this film seen by anybody. And we're getting, pressures from the pharmaceutical industry on theaters. We just got kicked out of a theater in Arizona because of pressures by the doctors in that area and the university. And I'll tell you, they are afraid for people to see this film because everyone seeing this film is coming out realizing we're all being lied to.
Right, and this is just another argument for government not to be involved in healthcare, because when they do, politics and money interests supersede the interest in the safety of the American people. Tell me about the response to this film. First of all, what were you hoping that it would accomplish besides just exposing the whistleblower? And what have people's responses been after coming out of the theater?
I think public education, what we've tried to do is to set out here the facts. This is not opinion, it's not my opinion, it's not based upon conjecture, it's based upon the hard documented facts presented to us by Dr. William Thompson, his recorded phone calls, the data analysis, all of the documents that were developed contemporaneously as this study unfolded, including his communications to his superiors at the CDC saying, look, we have a problem. And they ignored it. Right to the top of the CDC, they ignored this. They could have made it better. They could have done another study. They could have made children, put children in a much safer position that they chose not to. So we want people to see this. We want Congress to act. We want the Congress to bring forward Dr. Thompson, to subpoena him, to hear what he has to say, to bring forward the other co-authors, and indeed right up to the head of the CDC at the time, Julie Gerberding. These people need to be brought forward. Their testimony needs to be taken under oath, and we need to get to the bottom of this issue.
This story is going to make Watergate look like a child's game. This is a massive problem. Millions of children being put in harm's way. You have to understand, a film is not a court of law. All we are as journalists and filmmakers, all we can do is ask the appropriate questions. When you have a top government official coming forward, one of the top scientists at the CDC saying we're committing fraud, we think the American people deserve to hear that story.